Hello everyone. Today we are going to discuss about the exercise to avoid for inguinal hernia. What is hernia? Hernia is defined as the bulging of an internal organ through a weak area. It is maybe due to tear or weakness in the muscles. Most hernias occur in the abdomen. An inguinal hernia occurs when tissue, such as part of the intestine, protrudes through a weak spot in the abdominal muscles. The resulting bulge can be painful, especially when you cough, bend over or lift a heavy object. However, many hernias do not cause pain. An inguinal hernia isn't necessarily dangerous. Inguinal hernias occur because of a weakening of the muscles in the lower abdomen. The three layers protect the intestines inside the lower abdomen. The first is a thin membrane called the peritoneum. The second is made up of the abdominal muscles. And the third is our skin. Inguinal hernias may occur on one or both sides of the body, and are much more common in men than women. An inguinal hernia can appear at any age. An inguinal hernia can also develop over time if you increase pressure on the walls of our abdominal muscles, through activities like straining to go to the bathroom, coughing over a long period, being overweight, or lifting heavy weights. Types of inguinal hernia. Inguinal hernias come in two types: indirect inguinal hernia and direct inguinal hernia. The indirect inguinal hernia is the most common type, and a type of hernia that you may be born with. Although it can occur in men and women, it is much more common in men. This is because the male testicle starts inside the abdomen and has to go down through an opening in the groin area to reach the scrotum. If this opening does not close at birth, a hernia develops. In women, this type of hernia can occur if reproductive organs or the small intestine slides into the groin area because of a weakness in the abdominal muscles. The direct inguinal hernia is caused by weakening of your abdominal muscles over time and is more likely to be seen in adults. Direct inguinal hernias occur only in men. How to prevent the inguinal hernia? Direct hernias that occur over time may be prevented with these precautions. Learn how to lift heavy objects properly. Treat constipation to prevent straining when having a bowel movement. Get treatment for any persistent cough. If you are a man with an enlarged prostate and you strain to pass urine, try to get treated. If you are overweight, lose the extra pounds. The best exercises for people with hernias. It's best to stick to low-impact activities to avoid making the hernia worse. Swimming, walking, gentle yoga, cycling is best exercise for people with hernia. Exercises to avoid when we have a hernia. There are certain exercises and activities that you should avoid when dealing with a hernia. Some of these include heavy exertion exercises, such as weightlifting, that cause you to strain. Overstretching your abdominal wall. Movements that lengthen the abdominal muscles, such as an upward dog position in yoga. It puts strain on the muscle walls and should be avoided prior to surgery. Core exercises such as planks, sit-ups, crunches and some Pilates exercises. High-impact physical activities or sports. Flutter kicks, seated knee tuck, bicycle, crunch, leg raise, plank, plank jacks, cat and cow exercise. Please consult your nearby physical therapist before start the exercise. Thanks for watching.